Hi, I'm Dr. Teresa Sievers, and as I promised you, I was going to be bringing you different modalities of healing. I think it's so exciting for people to find new ways of preventative health. This is one of the largest problems with our healthcare system. We don't do preventative medicine. We do reactive medicine, and we wait until people are good and sick, and then we start treating them. But just what if we actually stopped and looked at how to do preventative medicine? What might our healthcare look like? Maybe we wouldn't be ranked 32 in health in the world. Maybe we'd be one of the higher countries. I have today with me a special guest, Dr. Robert Korolevich. He is a board-certified family practice medicine who attended the Eastern Virginia Medical School. He completed a residency at Bayfront University. So yes, he was traditionally trained, but that's not what he does anymore. Like myself, that was just a stepping stone for where he's at now. Without any further ado, let me introduce Dr. Robert Korolevich.
Thank you for having me.
Thank you. Thanks for being here. So tell us a little bit about how you made the leap from doing family medicine, traditional MD, to becoming where you're at now.
You know, it's interesting because I've been in practice for over 20 years, and obviously, like yourself, practicing traditional medicine as we were trained to do for many, many years. And, you know, day after day, treating people, taking care of their acute issues and thinking that's the way to do it. And I happened to stumble into an educator at a lecture that was teaching topic in integrative medicine. And it just spurred my interest, and I knew there was something more to what we're doing than what we had just learned. So I decided to throw myself into that whole integrative educational field, and I started seeking out forums where we have these wonderful educators out there that have been doing it for many years. And I just threw myself into the whole educational process, started learning a lot of new things that I'd never learned. And what was interesting is that I started integrating, if you want to use that word also, what I was learning into my practice. And I started realizing that instead of just treating the acute problem, as we all do, which we're all very good at here,
right.
I was giving people alternatives. And now where people, in this internet age where they have so much knowledge out there, so much information, the problem is they can't decipher what is
exactly
is good and what is not.
And the doctor becomes the computer.
Exactly. and so what I find myself doing now is teaching people. I've become not just a healer, but a teacher, and education has become a very big part of my practice. And everything that I learn, I start incorporating into my practice. And what I find is that, you know, I can use my experience from both sides of the spectrum. I'm a traditionally trained physician, but I'm also trained in the integrative field of medicine. And so now I approach a disease process rather than just treating the acute problem. I start to work my way backwards to find out what the cause is and can I reverse it and how can I prevent it. So,
and I love that you said, I teach my patients, because actually to be a doctor means to teach folks.
it does.
And ultimately, the patient does heal themselves.
Mm-hmm.
You give them the tools. So I know one of your big areas is you spent a lot of time studying with Dr. Mark Houston, who is a big integrative cardiologist, and you spoke very highly of, and that's kind of become your niche of age management and preventive health. And I think that people need to realize this is important because with the new cholesterol guidelines out, basically everybody needs to be on a statin from the age of 10 and on. And I don't think the public knows that 50% of the people who have a heart attack have normal cholesterol, folks. So there's something else. And this is something that Dr. Korolevich has been specializing in. So I come to you, 55 years old. Both of my parents have died of early heart disease. I think I'm eating pretty healthy. I don't smoke, and my cholesterol is a little bit elevated. And of course, I've come to you because I want an alternative to the statin. How do you approach me, and what testing might you do?
Interesting. I just had a gentleman like that about 2 weeks ago. He's in his 50s. He actually runs marathons, very healthy. He's already made some changes in his lifestyle, but he has a very strong family history of heart disease. And his big concern was, you know, am I at risk? It's a really concerning thing. My previous doctor wants me to be on a statin because I have an elevated cholesterol.
Right.
So obviously we evaluate his genetics, his family history, very important because, you know, I always tell patients we're born with our genetics. We can't change our genetics, but we can modify our pathway to prevent our genetics from working against us.
So that word, folks, so we can educate, is called epigenetics.
Yes.
It means that although we can't change the genes, we're really only 5% our genes because we can turn genes on and off and have our cells see the good genes that want to do well for us.
Right. And as Dr. Houston taught me, there are over 300 genetic things out there that can lead to cardiovascular disease. We may only be able to test for a portion of them, and a smaller portion may be important at this point. But as the science advances, we will be able to incorporate a lot more of these tests into our practice. So I take a series of blood tests that will actually help me look at their genetics a little bit closer, as we did with this gentleman. And I was able to find certain things that probably are the reason why he has a family history of coronary disease premature. But he's already started down the correct pathway to correct it.
Because the exercise is turning on the right
The
genes.
exercise, the proper diet, he's already doing things that in his family, his father and so forth did not do. But now we were able to find other things, and actually I talked to them a lot about this concept of inflammation.
Great, that's exactly where I was going to go with it, so I'm glad, because inflammation's a big buzzword, and how do we fix it?
Yeah, well, it depends on, you know, what's causing inflammation. Again, through wonderful education through someone like Dr. Houston, you know, we're able to learn that the body is always going to respond the same way to various insults. We may have various insults out there, whether it be our genetics, our nutrition, our habits, environmental toxins, etc. But the body's always going to respond with inflammation, oxidative stress, or your immune response, you know, no matter what. And those things are the things that lead to disease or plaquing, etc., etc. So we start looking at markers, which we have readily available now.
Yeah, I think you're using the Cleveland Heart Lab.
I'm using the Cleveland Heart Lab. You know, SpectraCell is doing them now. They're actually getting together finally at my request, I think, maybe. They're actually putting a panel together where SpectraCell is actually sending off to Cleveland Clinic,
yeah, and
which is going to be good.
And people are aware of this CRP. They've heard of that and inflammation. But what people don't realize is the testing that Dr. Korolevich does, sometimes the CRP is normal. But he finds other inflammatory markers that are more predictive of the heart disease.
Right. And again, I do a lot of teaching in the office. I use a lot of visuals. I tell them this is what the science is showing us in our literature now. And so I talk to them about the formation of plaque and how inflammation is involved. So I show them how if their LDL is elevated, we need to see whether this LDL really needs to be treated.
Yeah,
and
is it a good or a bad LDL?
Exactly. You know, so we start looking at the whole breakdown of that whole structure of cholesterol.
Great.
And we start looking at the inflammatory markers and see whether they truly are at risk. Because the other statistic that's interesting is that 80% of events, and by events I mean a heart attack or a stroke, are caused by plaques that are in the 20 to 40% range.
Thank you for bringing that up.
So whereas most of us think that just a plaque slowly forms and then we have our heart attack, it's the person that's walking around thinking that they're healthy, they've passed their stress test, their cholesterol may be controlled on a statin, and all of a sudden they have this silent inflammatory process going on, and it causes a rupture of a plaque, and they have their acute event. And
there are markers that are showing that
there are markers that show that. So that's something I stress in the office to see if, and I tell them my whole job is to make sure, number one, you're not going to have an event in the intermediate future, because there's very good data how these markers can determine that. And then hopefully, you know, start reversing disease if you're showing signs of disease, and obviously prevent it.
So I know you work about diet, I know about exercise, and we're kind of short on time, but there's two things I want to touch upon briefly. One is testosterone in men, because I know you treat a lot of men. And so the news has been broadcasting and smothering all over the place that testosterone causes heart disease.
Right.
And so I looked at that data myself, and I've got a lot of problems with some of it. So I'm just curious on what because I'm going to come to you now and say, well, my husband's on testosterone, and I don't want him to be on it if I'm a patient. What are you going to say to me in a few words?
I get that all the time.
Yeah.
The interesting thing, again, most doctors get their data from just one journal blurb or one news blurb, but smart people like yourself are actually looking at the data. Plus, I listen to people that have actually evaluated the data. There are a lot of
like Dr. Morgenthaler, who's one of the
Morgenthaler,
pioneers in testosterone replacement
and he's
therapy.
leading a consortium of 150 scientists and urologists throughout the world who are actually banding together against that data that came out because it wasn't correct.
It wasn't correct. People were not having their blood counts monitored.
Correct.
Right? And so we know testosterone can raise the blood count.
Plus,
And if it does, they run a risk of plaque.
Plus, a lot of the data was being collected by prescription, numbers of prescriptions being filled. So
interesting. I didn't realize that part.
Yeah, so there's a lot of data that was incorrectly gathered, and you heard the study from the VA that came out showing one thing, but there was a similar study done at the same time with a very large population that showed the opposite effect.
Yeah, so that's great.
And nobody talked about that. So I tell my patients, the data really does not prove that testosterone is dangerous to your health or is going to cause MIs. I think there's a little pause that we should take back to maybe why in the first 3 months they may have seen, maybe plaque rupture or something. So there may be something in that, but realistically we have many, many years of good data that support the benefits of testosterone.
And the last thing that, as we close up, is you mentioned about oxidative stress, which is this whole process that people, what is that? Basically, it just means, folks, that you've got normal waste products in your cells and your body is unable to get rid of them efficiently. And just like when garbage piles up in your house, it affects how your house smells and functions. And when you want to have people over, it affects how our body functions. And the other big area is the immune system. And the last, I want to close because I'm going to be segueing. I'm going to be meeting with a certified master life coach because often you meet people who are doing everything right. I mean, you're like impressed by them, right? Like, wow, I don't even do all that, right?
Right.
And yet, you keep getting these markers back from inflammation or their immune system and something's going wrong. And you find out when you sit a little longer, they have a brother that they've not talked to in 25 years who they absolutely hate, and just mentioning their word raises their blood pressure by 15 points. So do you talk to them about stress management? Because there's tons of data now that's also showing that.
I actually do. During my, when I was doing the program with Dr. Houston, we spent a whole day with a cardiologist, an integrative cardiologist in California. I can't remember her name right away, but we had a 3-hour lecture, and the data is remarkable, showing how stress can lead to cardiovascular disease and events. I just never knew.
It's mind-blowing, right? And these are people who are doing everything else right, folks. So it's not just about your nutrition, your exercise, your hormones being balanced. It is about that mind, body, spirit. So I'd like to thank Dr. Korolevich for coming with us and being on the show today. You can find him on his website at, what's your website?
Korolevich.
RKOROLEVICH.com. We're going to be following up now with certified master life coach Mary Lynn Ziemer, and she's got an interesting perspective about stress and how we can affect change within our bodies.